Every hour, someone dies of oral cancer. Of the 36,000 people who will be diagnosed this year with it, only slightly more than half will be alive in 5 years. Survivor rates are so low because it's not detected until it's too late. But as News Channel 5's Roxanne Stein reports in today's medical breakthrough, there's a simple and painless test at the dentist's office that could save your life.
Robert Levine is one happy guy. He avoided disaster just by going to the dentist. During a routine cleaning, Robert's dentist found something on the bottom of his tongue.
He saw a spot on one side.
The almost undetectable spot was dysplasia, a precancerous cell.
One of the biggest problems with adenocarcinoma today is when we find it and diagnose it, the median survival is less than a year.
Head and neck surgeon David Godin says the key is to find it early before a precancerous cell turns into a carcinoma.
This lining we're talking about is the thickness of a piece of paper.
Mark Ruttenberg used the same technology he created in the military to determine nuclear warheads from decoys to create oral CDX. It's used to detect abnormal cells among normal cells. It's a brush test that sweeps across the inside of the mouth.
We check the mouth, tongue, the vestibular area for white spots or red spots.
Traditionally, cancerous cells were found after lesions or other symptoms appear. Then doctors performed a biopsy, which would miss the cancerous cells.
Tiny little white spot on the right side of your cheek.
There's no anesthesia, and it takes just a few minutes.
Voila.
The brush biopsy is sent to a lab where 200 of the most suspicious cells are analyzed by specially trained pathologists. A cancerous cell has 6 to 8 genetic mutations. A precancerous cell has 4.
If you can find those cells and remove them, you can prevent cancer before it starts.
Gastroenterologist Elliot Heller took part in a clinical trial using a similar brush test, plus the traditional biopsy to detect esophageal cancer.
We had a 40% increase likelihood of finding Barrett's.
This brush test could be key to stopping